The first author, Joa, is not here with us, but sends his greetings. So as an overview, we're going to introduce you to our ongoing project and then talk about the mapping approach being used in the project. And then after that, highlight the current state of slum mapping in the project. And then talk about some issues which we hope will kickstart the discussion. So the ongoing project is National Institute for Health Research, Global Health Research Unit on improving health in slums at University of Warwick. And the short-term goals are to map some identified slums and then capture health services and facilities and also understand how they are used in these slums. Our medium-term goal is to identify the costs associated with how the health services are run in these slums. And the long-term goals are to build models of health services and try to investigate how they could be improved. And also to create a platform of funded activities. And across these goals, we will involve people who can change things in the slums, like politicians, slum residents, and also the OSM community who can also help build quality baseline maps. And also to bring together all existing evidence relevant to slum context. So the project is a 4-year project ending in 2021, and it costs about £5.7 million. There are 5 project partners, 2 in Asia and 2 in Africa, with the lead institution being the University of Warwick in the UK. So in Africa, we're working with University of Ibadan in Nigeria, where 3 slums are being studied, Shasha, Edikan, and Bariga slums. And we're also working with African Population and Health Research Center, APHRC, in Kenya, where 2 slums are being studied, Korogocho and Viwandani slums. In Asia, we're working with Aga Khan University in Pakistan, where 2 slums are being studied, Azambasti and Neelam Colony. And lastly, in Bangladesh, we're working with Independent University, Bangladesh, where Korea slum is being studied. So these slums actually vary in, the size of the slums vary actually, and the biggest slum is in Nigeria, Shasha, and then the smallest is in Pakistan, Neelam Colony. The project also has 5 work packages. Work package 1 deals with geospatial mapping of the slums. That's where we're actually based. I'm working from. And work package 2 deals with household surveys. Work package 3 deals with evidence synthesis, bringing all evidence together relevant to slums. And work package 5 builds health services and models about health services and try to understand how best to improve them. And work package 5 deals with stakeholder engagement and touches on the other work packages. And so work package 1 has 4 main phases: the preparation, satellite imagery digitization, participatory mapping, analysis and visualization. We'll talk more about this later. The outputs of the work package 1 are social spatial data, which consists of accurate and detailed slum maps at building level, and also household health listing. And this information is going to be used to construct a sampling frame, which in turn is also going to be used to sample at least 1,000 households for further surveys. And the output also include healthcare data, which consists of information about health services and facilities and derived accessibility metrics. And also, we will develop a methodological framework that will address simultaneously spatial data quality and community engagement. So we are combining methods from geographic data science and social research to tackle a methodological challenge. So the method is actually situated at the intersection of spatial data quality, for example, completeness, and community engagement, such as training slum residents and involving them in the process. Our mapping approach starts with some preparation activities, which involve where training materials are prepared, responsibilities for subsequent stages are also defined. Also, procurement of high-resolution optical satellite imagery, identification of slum boundaries, and also using Hot Tasking Manager to develop online mapping platforms are also done at this stage. Also, Slum access permissions are also negotiated at this stage. The online mapping stage involves using the developed online mapping platforms to organize our training sessions and mapathons to achieve complete digitization of the slum areas. Here, the mappers were also are to be, some of them we've already done this stage, so were actually authorized to map on the platform. The online validation stage involves correcting errors identified after the online mapping stage. The GPS field mapping stage actually is where the field activities start, or the ground truthing. And so the slum access permissions are actually needed. And this stage involves using handheld GPS trackers to track the footpaths and then the road network with the aim of first validating the network and also densifying the network. And the data collected at this stage is used to update the OSM database online at the GPS digitization stage. After this, we print the field paper maps and take it to the field and verify the structure geometry, and simultaneously also record unique structure codes and some field notes using a tablet. Here we are using two open source technologies. We have Open Data Kit and then Open Map Kit. Beyond this, we scan the field paper maps and conflate the OSM database online. And we end the field activities with a household health survey and then healthcare facilities survey, beyond which we construct the sampling frame for Web Package 2 to start, or the household surveys to start. I'll hand it over to Evangelist to continue. Thank you.
So based on our methodological approach or our mapping approach, we didn't want to create data ourselves. We wanted the people from those areas to create the data that they're going to use afterwards. So in order to do that, we held some mapathons. We held 6 mapathons in all of our sites, 3 in Kenya. You can see some pictures here. 1 in Nigeria and 1 in Bangladesh. And what we did was we provided technical support to those mapathons, which is more difficult than it sounds. And we also helped in validation for some of those sites, but we also had a really good help from the hot OSM community in doing that validation. What we did was first to train some people from those sites, because they were not familiar with OSM platforms, train them how to produce maps on that, and afterwards they trained the community participants in there. As you can see here in this stack graph, we had some, in the areas that we have here the number of, with a dark black, the number of trainers and facilitators we trained, and the lighter gray is the total number of people that were trained. Those people, this number includes people from the community, people that are slum dwellers, or people that are just volunteered to map in those areas. Let's see what we have done with that approach. So that was the state of the 2 slums in Kenya. This is Viwandani on the left and Korogocho on the right before we entered. As you can see, there are not a lot of things in there. Some buildings in Korogocho from a previous project, but not a lot of information. And this is the current state. This is what we've created now. In total, we have added more than 13,500 buildings and around 2.6 kilometers of road. This is just for the areas, because the mappers were so keen in producing more data that they have actually produced much more information outside of the area's boundaries. These are our results in Bangladesh. This is Korail in Bangladesh, which is one of the first slums in the world that has been researched for such purposes, and this was the state before the mapping. So as you can see, there is still a lot of, there is already a lot of buildings, a lot of roads in here. However, this is what we have produced. We have added some buildings here, just more than 1,700, but a lot of roads in this case, almost 20 kilometers of road. This is the case in Kenya, in Nigeria, sorry, which was for me, our most interesting example, because as you can see, there is almost nothing in the on the slums. This is Bariga, this is Ibadan, there's nothing in there before our mapping, and with a great help. In this case, we had the help of the university that had a geography department, so they have GIS students who knew what they were doing from the beginning. They were much more easy to adapt, and this is the current state of it. It's quite remarkable, to be honest. Almost 10,000 buildings, around 35 kilometers of road, more than 35 kilometers of road. But if you see those areas now in OSM, around the boundaries of the slums, there are much more buildings that we have mapped, a lot of more roads, and a lot of more information that we have added. As you can see in here, they were so keen in mapping that they have added green spaces, they have added streams, rivers, everything. They were really, really keen in doing that. I'm passing it out of Philip.
Okay, so you can see we've added a lot of spatial details to the map, and for us it's important because this spatial data will form the evidence base or the base for our sampling frame, which is going to be used for the household service. And the household service, this is going to be spatially restricted, or there has to be a certain minimum distance between the households for the catchment area of the healthcare provision. So that's why we need this very detailed spatial data. And on the other hand, we want to make sure that we have a high level of community participation, because we want to create inclusive data where we have where we know about the local context, where we know, for example, what might look at the map. When we look at the map from a top-down perspective, you could say maybe there's a corner shop, but if we have the local information, we might know that that corner shop also might provide some form of healthcare. And we only know that if we really engage with the community. And by doing that, we also create some, or we hope to create some kind of shared learning processes, which we hope would lead to community empowerment as well. So we needed to come up with some kind of systematic approach to create both these kind of processes effectively, and we've done that with multi-level collaboration from the local level to the global level. And as Godwin and Vangelis have mentioned, so we've first trained the trainers locally to organize mapathons with the community and with other local stakeholders, which then did. And then for validation, we worked with our local partners, so the universities and the African Population Health Research Center, for example, at the local level. They also did validation, and the wider OpenStreetMap community and other volunteers. And then ground truthing will be done by our partners on the ground, also with the participation of the community. This is just to show here the mapathons in Bangladesh and in Nigeria with our partners and the local community on the local level. And here at the international level, just as an example, our student mapping society in Warwick, the Warwick Resilience Mappers, also to represent the participation of the wider OpenStreetMap community in this project, for which we are very grateful. So in the end, what we want is we hope to create a methodology, a systematic methodology, which is sensitive to the contextual characteristics of the place, of the space, and to create trusted evidence for policies, for urban policies, which are representative, or as representative as possible, especially in places that were previously underrepresented, such as slums. So in the research, we think actually, I mean, we have done this project, and we think there's some kind of trade-off in terms of quality, because so there's a discussion to be had about what are the parameters of quality in OpenStreetMap. So to what extent do we want to include local meaning into accepted classifications, which are the tags in OpenStreetMap? To what extent is that possible? To what extent do we want to have local participation? Or do we just need to limit it to have objective accuracy? We just need to know the structures. We don't need to know exactly what these structures are. it depends on the situation. And also the other discussion that might be interesting to have is, do we want to know exactly that a corner shop is also provides some kind of healthcare, or do we just want to make sure that all the structures that we can see in the image are digitized? So we want to put it out to the community that we actually we want to trigger discussion about what are the parameters of quality. Most likely they will be related to the project needs and to the local context. And this discussion also relates to a discussion that was recently in the humanitarian OpenStreetMap team. In the mailing list, there was someone who said, "What's the obsession of HOT with digitizing every little structure?" Well, this kind of questions we could answer if we think about what quality means and in which context and the project needs as well. So, for example, in an emergency situation, we just might want to know that there is a structure, there's a building, and where the roads are. And in other projects, we might want to have more local knowledge. And also the other question is, should we include some kind of qualitative criteria in the question of what is quality? Should we ask, to what extent has the community been involved? And is the data inclusive enough? So these are the kind of trade-offs that we might want to think about collectively as between researchers and the wider OSM community. And so just to finish, we want to thank the OpenStreetMap community, humanitarian OpenStreetMap team, and Missing Maps, whose help was incredible throughout the project. I think it wouldn't have been possible without you. And our partners and funders, the UK National Institute for Health Research, University of Warwick, the African Population and Health Research Center, the Independent University of Bangladesh, Aga Khan University, and the University of Ibadan. So we'd like to turn discussion to you and to the wider OSM community. If you have any ideas to talk about this kind of issues of quality or anything else that came to your mind just now, so please get in touch.
Thank you very much for this very interesting presentation. Are there questions? Okay, I kindly ask people asking questions to stand up.
Hello, thanks for this presentation. I'm impressed. I was myself in third world countries 5-6 years ago in a previous career. If I had that data, it would have changed the way we delivered programs, definitely. I had more of a human sciences question to you. What was the impact in terms of the way the locals perceived their slums after you showed them with their maps? Did it change the way that they perceive their slums? Because there is a weird phenomenon, which is that sometimes there is an attachment to the misery that surrounds them. They feel close to it and proud, I mean, even sometimes proud of what they have been able to build, even if it's just a little. So your mapping work, has it changed the way that they see themselves? Thank you.
Thank you for the question. I think for now the project actually, like I said, is 1 year old roughly. So I would say that for the work package, I think what your question is probably might be addressed by work package 5, where stakeholder engagement is going to be more intensive. So at the moment, the maps we've shown actually is still ongoing. So the method that we showed is really roughly about the GPS field mapping stage. So we really have a lot to go in terms of completing the map. And then we jump into really the details about the stakeholders, the perceptions and all that, and which is also linked to the questions we're asking about qualities. What is quality? So even we could consider that as more or less a quality, that perceptive quality about, you know, how the OSM community perceive OSM community in terms of, or let's say the slum or the community themselves, the slum community perceive the maps, you know, and as a way of sort of defining quality, you know. So we're not reached there yet, but so in a way, I think the question is still hanging. Probably we'll come back again after yes, after a while, and then to address that. Yeah, thank you very much. Maybe my colleagues.
It's a really nice question, and it was something that we're really interested in as well. But the thing is that it's very context based what you're asking. So like some of the slum residents, for instance, did not understand that they were actually living in slums. They thought that they were just living in in a city area, for instance, in Nigeria. So there are these types of perceptions that we want to address on the data as well, but are very context based until now, from what we have seen.
Actually, I think someone you might have also been in touch with or known, I think Map Kiberia, they're going to hold a presentation. They might know, if you talk to Erika Hagen, she has got a lot of experience in that, so it might also be an interesting question to ask her.
Hi, thank you. Great presentation, and thank you again for sharing previously your documentation about using field papers, which was extremely helpful. I wondered if you'd had any particular issues about using field papers and so on that you might be able to mention.
I think probably we might have to also acknowledge the presence of Tassaf, the OSM community here. Tassaf has been very active in our project, and we really appreciate what he's done. So he's here, so I think it's best to acknowledge him. He's actually also done a bit of, just to link to the question, a bit of the field papers on the ground as a way of helping us in the project. So I don't know if you want to say something about that. But for so far, generally, from what we have experienced so far, both in testing, going to each of the slum areas to test, and with our experience with Tassaf, I think we've not really had any challenge. I mean, major challenge. You know, we think that actually is a good way of starting, especially with the slum residents who have actually no IT skills, and the field really is a starting point. Really, it clicks with them. They see things, they can easily draw. You know what I mean? So it's something that I think is very important in a project like this. I don't know if Tassa would like to add something to it.
I'd rather say that what we have implemented over there, we have a bit of blend of using OpenMapKit and at the same time using field papers as verifying the things or double checking the things. When in the field, we just send two of the field mappers at a time as a pair. So one is collecting data with OMK, where other is drawing on the field papers. That certainly validated us afterwards when we validated the or ground truthed the things they have done over there. If those matches properly or something is missing. With OMK, it is hard to draw over there building structures and stuffs. In the dense areas like the slum areas, with the satellite imagery, you won't be able to find out whether there is one or two buildings at a time or a cluster of buildings are there. From the satellite imagery, it is shown that it is either a single building or there is two buildings, but at the end of the day, we found out that there is almost 5 or 6 buildings out there. So when field papers are there, it helped out the guys on the field to also draw those divisions within the cluster of the buildings, and that helped us to identify the house numbers and IDs, structure IDs we are planning to give over there. So not only the structures were mapped, the structures were given identification numbers, so that afterwards, when the survey will be done by the Warwick University afterwards and the other partners, they will be easy. Those will be easily to detect and trace out afterwards.
Can I just ask, how did you give them the identification number? Did you use plus codes or anything like that?
There is a convention.
Yes, we have a naming
there.
convention that we've developed, about 13 digits, which is based on the field paper sheet number, enumeration area, and all that, up to the numbers that are written on the structure. So the first time visit to a structure, we number it as 1, and then it follows. So it builds up from there to the field paper sheet number or letter or code. Yes.
Thank you.
Maybe I'd like to add a point to that as well, because there's another issue that we observed, or that's generally being observed in the community, or with people who actually do some mapping in the slums. So when you look at the doors of the individual households, you can see that whenever there was a study, and every different study had different kinds of conventions, and you can see it's like because there's a list of different numbers. So there's another issue that we would need to talk about, and generally that's being discussed, is how can we make sure we're not duplicating efforts all the time. And yeah, that's basically a key question, I think, especially with mapping in slums.
Hey, thanks very much for iRise. Yeah. So it's very nice to see how much when we're doing research in those countries. Now we're doing research with OpenStreetMap, and we're building the data we need, and we also want to build a sort of data folk, a community around the data. And what I think really interesting in the project that you're putting forward is that you first add an iterations to build the structure, I mean the rough base layers, and then what you are describing as the quality data will be the details that you're going to add to the map. And that's something which is not common when you run those kind of research project, when it's focused on one thematics. Usually there are very specific needs for the study, and then you come with a list of features, and when it boils down to resources to get the data in, then it's very difficult to adjust to the needs of the local people living there, or the people working or using the data. So I think it's extremely interesting in that approach. So that was one comment that I wanted to make out of your specific project. And then this also triggered the question for me in terms of what is really sought from the project in terms of intelligence that you want to produce over the territory under health perspective. Are you focusing on specific health items, or is it just something which is broad about how health facilities are being used and managed? And so yeah, I think that this is it for me. And the second sub-question is, what are the resources? I mean, how are you managing to, in very poor areas, to have people just going, mapping, and how are you creating the mechanisms for those people to be in a position to map and perhaps to continue mapping? Or are you going to accommodate with some stakeholders that are keen on going on a workshop, but they will want to have some workshop fees, per diems, and all the things which are very difficult to handle if you want to build sustainability over time. So that's the remark and the two questions.
So for your first question, this is actually what we're thinking about promoting OSM in such projects. This is a project funded by the NHS, by the NIHR, which is like health organization. So the whole concept of the project is to provide better health to increase to enhance healthcare provision in those areas. Our approach was for mapping that. They didn't actually want us to use OSM. They just wanted the maps. This was our approach, supervisor's approach, Joao's approach, that chose to do this, to choose this itinerary to go this way. So yeah, this is a way of promoting OSM in general, and we were discussing about that before, about how we can make this academic. This is actually a project that is a personification of this endeavor.
Just to add to that, first, thanks a lot for the positive remarks, and also on the issue of resources, we're working with the local partners. We mentioned University of Ibadan, Aga Khan University, APHRC, and Independent University of Bangladesh. And so we're also tapping into the resources of the OSM community. And one typical example is our relationship with our cooperation with TASAF, who is the leader of the OSM community in Bangladesh. And they helped us a lot in terms of the logistics and the best way of kind of collecting or doing the mapping. And because they've already had the knowledge of the tools that we're using, and so the training was a little bit reduced from our side. That was very useful for us. So they had to just go in there as facilitators, train the core local partners, the project team there, for them to understand the best ways of doing things. We also organized through Skype several training sessions, and then beyond that, sort of train the trainers kind of thing, and to allow them to also, especially with the mapathons and the training sessions, they were able to then organize their own mapathons and organize themselves locally to map. And beyond that, not necessarily just mapathons, they were also, the core team were also doing the mapping afterwards or in between. Yeah, so I think in that sense, that is it. And we also bought handheld GPS devices, especially for the GPS tracking and others. It's not that much, but we were able to at least, I think for each slum we bought just one Garmin handheld GPS, and we were able to use that to densify the network or validate the what has already been mapped and things like that. Yeah.
Okay. Sorry, I have to stop the discussion here because we are already out of time.
And sometimes, yeah, and we're providing per diems as well. We're providing per diems as well for the slum residences.
Okay. Okay. Just one announcement. If you have a presentation in any of the rooms, please upload your slides before, in the coffee break or in the lunch break before, especially if you have a lightning talk, because lightning talks are very short, so we need everything already on the computer or show up if you're using your own laptop. Thank you very much to the presenters and to the audience for the discussion.